joining us today. I'm Jo Christine Miles, and I am very excited about today's conversation discussing financial health networks, new research on the financial health of persons with disabilities. The research itself is rare when you think about the fact that there are 40 million Americans experiencing or who have a disability, and the fact that most people, that means most of us in this room, will experience a disability at some point in our lives. To me, that's very sobering. The research itself also provides some rare insight into the host of barriers that people with disabilities face. I'll share a few of them now. Working people with disabilities are financially healthy at just a third of the rate of persons without disabilities. Many live on very low incomes. We're talking 30,000 or less. So 45% of the respondents reported incomes under 30,000. That's more than twice the rate of persons without disabilities. And underemployment remain high for a host of reasons, ranging from lack of accommodations at work, negative attitudes at work, transportation issues, et cetera. And then, of course, intersectionality remains an issue. By way of example, women with disabilities are half as likely as men with disabilities to be financially healthy. So with that, we're going to turn to our experts. We have a wonderful panel here today. I'm really excited to talk to them as well. We have John Sioka. He's the founder and CEO of Purple, a fintech company that is working to create a more inclusive banking system for people with disabilities. Previously, John founded You Belong, the first social network for people with disabilities. Welcome, John. We have Kimberly Noxted. She's the Senior Fellow at the Century Foundation and Director of the Disability Economic Justice Collaborative. She focuses on economic justice for people with disabilities and their families, and prior to Century Foundation, she served in several disability policy positions in Congress and the White House, and served as the first Director of Disability Policy for the Domestic Policy Council for the Biden-Harris administration. And we have Thomas Foley, Executive Director of the National Disability Institute, a national nonprofit dedicated to advancing the financial stability and economic strength of persons with disabilities across the country. Tom Foley brings more than 30 years of experience serving the disability community, seeking to address the complex drivers of economic insecurity. With that, I'd like to dive into our first question. The report indicates that more than half of the people with disabilities are unable to pay all of their bills on time. So that's people living right on the razor's edge. Open question to the panel. What would you consider to be the top drivers of this reality for persons with disabilities?
Well, maybe I'll start. And thanks again to Financial Health Network for the opportunity and to Principal for making this work possible. One of the things we saw in the report is that people with disabilities are employed at significantly lower rates than their non-disabled peers. If we look at the unemployment rate for folks with disabilities is 3 times higher than the rate for non-disabled people. But even more importantly, what we see is the workforce participation rate for people with disabilities is in the low 20s, as opposed to the mid and high 60s for people without a disability. But I do want to say there is some good news around that. One of the things we saw during the pandemic, which has been really exciting, is for years and years, people with disabilities have been saying, we really wanted the job, wanted to be able to work, but because of transportation or accessibility issues, working from home was always something really important to the disability community, and the community had always been told, we couldn't do that. And of course, everyone in this room remembers 3 years ago when all of a sudden we all figured out how to work from home in a couple of weeks. And so one of the really interesting data pieces that we've seen is during the pandemic, at the beginning of it, lots of people with disabilities lost their jobs. But during the pandemic, because of work for home, we saw that the employment rate for people with disabilities was actually outstripping, from an increase standpoint, the rate for people without disabilities, because they were able to work from home and have the accommodations they needed. And I think it just really goes to underline that, people with disabilities have far greater capacity to work than they do opportunity.
I'd love to build on that and do a little bit of context setting as well. So before fully jumping in, I'd like to note that yesterday was the 50th anniversary of the Rehabilitation Act of 1973. And so for those that don't know, that was the first civil rights law for people with disabilities in the United States. It was the first time we said as a country, you cannot discriminate against people with disabilities in federal employment, in any place that receives federal funding, in government technology, and we created programs to support disabled people in employment, so the vocational rehabilitation program. There were many other things that law did, but those are just a few kind of overarching pieces. I was at an event yesterday where we had the architects of the law, the architects of the initial regulations. We had those that are currently in the federal government creating new regulations. And then we had young leaders who were saying, we are the ADA generation, we are the Rehabilitation Act generation, and now we are ready to set the new landscape and actually look forward. We're ready to build wealth, we're ready to go into the jobs of today, and we're ready to work with you to do that. And so it was really the past, the present, and the future of disability employment and economic self-sufficiency for this country. And so I say all that because I'm also curious and would love to see a little audience participation here. How many of you, other than us up here, how many of you know somebody who is disabled? Show of hands. Excellent. That is what I love to see, because 1 in 4 people in the United States is disabled. You may not know who is disabled. You may not know by looks. I'm somebody with chronic illness. I mask often. It was only my recent jobs where I actually openly identified prior to getting those jobs, my last 2 jobs. And then before that, I was able to completely mask and did not openly identify. I was afraid of the stigma and the bias that would come with that. Of the 4 goals of the Americans with Disabilities Act, which are economic self-sufficiency, full participation, equal opportunity, and independent living, we have completely fallen behind on economic self-sufficiency for all of the reasons Tom just said. We are behind on employment, we are behind on a number of the other factors, and it's because we are not really building wealth. We are not creating opportunities for disabled Americans to actually move forward and advance. And it's not about lack of capacity, it's really lack of opportunity. And so I think those are some of the reasons that we are where we are today.
And I'll quickly add this barrier around asset limits. So for people with disabilities, if they receive government benefits like Social Security, Medicaid, they're not able to have more than $2,000 in assets across checking, savings, or investment accounts. This is one of the strictest limits of any federal program. And exceeding that asset limit at any point results in the termination of benefits. So for people with disabilities, now it discourages them from seeking employment, setting any money aside to save. And you can start to imagine how this creates a pretty vicious loop of receive your benefits at the beginning of the month, spend it down to zero throughout the month, and then there's never anything left to actually be able to afford a larger unforeseen expense or just to pay those bills.
And just to double click on John's comments about the safety net that should be in place, the research did show that of working age persons with disability, only 25% of them receive Social Security disability insurance, and 15% receive supplemental income. That doesn't undermine John's comments. What it does is it should highlight the opportunity gap that's present, because if they aren't relying on public benefits, they must rely on income. So increasing that opportunity, closing the gap is very important for working age persons with disabilities. John also leads us into another question I wanted to ask the group, and that is around opportunities for persons with disabilities to accrue assets, notwithstanding those limitations embedded in the federal law. And the primary vehicle would be ABLE accounts. I was quite disturbed to find in the report that 93% of people with disabilities had never heard of ABLE accounts, which is, like we just stated, the only mechanism available for them to accrue assets and not lose benefits over time. So let me turn first to Kim to talk a bit about that, and then Tom and John.
Absolutely. Back on? There we go. Absolutely. So ABLE accounts are really critical, and I think first noting that the system that doesn't allow disabled people to build wealth. So as we noted, asset limits being set at I would say actually discriminatory levels, and being so antiquated, and this structure isn't the system being broken. It's the system working as it is with keeping disabled people in poverty. And that's exactly how it was set up. It's exactly how it's working as it should, which is, again, pushing disabled people down. And so we need to note that we need to fix that system. And then ABLE accounts are coming in to be another option to try to build that wealth, if possible. So we do need to get education out there about what ABLE accounts can do. So education is absolutely key. We also need to note that, ABLE accounts, the social and socioeconomic capital to even access an ABLE account can be very difficult, trusting people to help you get one set up. And so that can be very difficult for many people. And actually having enough money in the bank to even start an ABLE account is very difficult for many disabled people right now. You have to have enough money to start saving money. And so right now, many of those people who are using ABLE accounts are middle income individuals. We actually had a great discussion about ABLE accounts with the Disability Economic Justice Collaborative that we noted that we run out of the Century Foundation. And we had some folks talking about this here, and they said they really would love to get more information out about how great ABLE accounts are for their children. But it took them a lot of effort to get them started, and it doesn't have to be that hard. And so building trust and helping to kind of kickstart ABLE accounts can be a really big piece of it. And ABLE accounts also are not a silver bullet to fix a problem with a system that is already problematic. These two things go parallel together.
Yeah, and just to follow up on that a little bit, I remember the first time I heard that people on disability benefits could only save $2,000. I thought they were joking. And as a blind kid who was going to school and working part-time because I always wanted to buy a house, it's something that really resonated for me. And I literally had to save money in a shoebox under my bed to come up with the down payment on my first house. And I'll never forget crossing Center and Shattuck in downtown Berkeley in February, just before the bank closed, with $15,000 in cash. Absolutely terrified that I would be mugged or something on the way to putting this down payment in, right? And that's just really bad public policy. But the other piece that it really underlines to everyone who raised their hand who knows someone with a disability, what kind of messaging is that? Right? The second you have $2,001, we're going to cut off your income stability. And by the way, we're going to cut off your Medicaid as well. I mean, that's very poor, public policy. We were fortunate enough in early 2015 to do one of the very first ABLE education campaigns in Berkeley, California. And we were really excited. We had a room that held like 200 people, and it was standing room only. There were people flowing out into the halls, but we had someone from the ABLE account, we had someone from Social Security, we had someone from FDIC and Treasury, and someone in the back of the room stood up and said, "You're telling me I can save more than $2,000? I don't believe you." And so I think that's part of what this education really has to speak to as well, is that we have a generation, we have multiple generations of people who have been told not to try, not to save, because we're not going to let you do it. At National Disability Institute, we run the ABLE National Resource Center. If anyone needs information from employers or for nonprofits or for individuals, ablenrc.org has information about every ABLE account in the country, how you can help us get the word out and really begin to change financial and economic expectations for folks with disabilities. But John, I know you have a product that specifically helps with this.
Yeah, so at Purple, we're building financial products for people with disabilities, and ABLE is a big piece of what we're doing. So with Purple, you get a checking account, a debit card, and an ABLE savings account. And each of these work together to make managing money kind of day to day less of a headache. So one way we do this is at the end of the month, we'll automatically move money from your checking account to your ABLE account so that you don't even have to worry about exceeding the $2,000 asset limit. And then another thing that we built that we like to call smart QD routing. So for some background, ABLE funds can only be used on QDEs, which are qualified disability expenses. So at the time of an individual making a transaction, we'll fund the purchase from the most tax-advantaged account at the time, taking into account the merchant, user preferences, so that they're kind of getting the most bang for their buck when using their funds. And we're building a lot around this ABLE experience, but we're really excited about the future of offering a full suite of products for our users around whether that's credit building, financial planning, special needs trust. There's a lot that we can do.
So in terms of educating individuals about the availability of even Purple accounts, what's your plan of attack on that? What's your strategy to get the word out?
Yeah, there's a lot partnering with organizations that have an audience and community kind of already built in, Special Olympics, things like that, but also even TOM, National Disability Institute, right? They have these ABLE educational materials and the resource center, things like that to really, first we need to educate about ABLE, because that's the biggest hurdle right now is that just awareness is non-existent, and then kind of going from there of meeting our community where they're at with through organizations that they trust, right? That's the best way for us to kind of also start building that relationship.
Excellent. Talking about appropriate and relevant. Thank you. I guess my mic wasn't working. Hello. Whole new level now. I'm on a new level. So talking about appropriate financial products for persons with disabilities, another key finding in the report is that people with disabilities disproportionately turn to higher cost forms of credit like payday and pawn loans. For many of us in the room, we know we're actively working to reduce the use of such products. They're extractive and exploitive among the general population, and we still have a high disproportionate use among persons with disabilities. So for the panel, what do you take away from this finding, and what could it mean for financial service providers generally?
Sure. So, one of the things that we're really excited about are some of these new scoring models for credit. Because when we look at the data and did the interviews in the study, what we heard was, my credit score is too low to get a loan, a bank wouldn't want to talk to me, that sort of thing. And quite often, particularly folks with disabilities, have very light or sometimes no credit file at all. And so, but they've been making regular rental payments on their apartment. They've been making regular TV payments. They've been making regular cell phone payments, quite often going back a number of years. So some of these new models that really capture that are really helping people build a credit file so that, moving forward, they will be able to participate more so in the mainstream. We've worked closely with Experian on some of their new products that help low income and particularly people with disabilities who are low income build a credit history and a better credit score. But I think what we need to do is basically innovate our way out of some of this. New tools, new services, focusing on people with disabilities. And I think there's a huge role for the financial industry to be part of that. Just circling back to the ABLE account discussion, financial planners, we raised our hands in this room. Everyone knows someone with a disability. Financial planning has an opportunity to talk about ABLE accounts. They have an opportunity to talk about special needs trusts. Mm-hmm. And there are lots of other products out there that we haven't even thought about yet that can really help serve people with disabilities and their families.
So first, there's the piece of giving people with disabilities the opportunity to actually build wealth, right? Going back to ABLE, obviously, is a huge unlock, right? Because today there's no funds to actually be able to cover those larger expenses, and that's what's leading to actually needing to go get that predatory financing. And second, I think there's a really cool opportunity to build more friendly financing around. There's likely a reason why they went to that, whether it's like a medical expense or something that happened. So whether it's funding or financing for disability-related expenses, right? Whether that's like assistive technology or things like that with friendlier terms, I think there's a lot to be done around there.
I couldn't agree more with what my fellow panelists said, and I think we also have to add that so many people in the disability community also go to GoFundMes, and we see that at a very high rate. And a lot of this, again, is due to medical expenses, and dings to credit are often, again, due to medical expenses. As someone, I consider myself, financially secure. I have a personal story from very recently. Again, I have a chronic illness, so I see a lot of specialists. The first time I received a bill from a medical provider, that same day I received a collection notice. I had never received a bill from them, and I received a collection notice on the same day. They immediately sent my bill to a collection agency. I had never had a late payment. I had been seeing them regularly for over a year. And I called them, and I also sent in a formal complaint, and everything was cleaned up and cleared. But imagine if you didn't have that social and honestly political capital, because I also sent a complaint to some friends on the Hill. So they're going to be receiving some oversight. But imagine if you didn't have that capital. Your credit score gets absolutely ripped apart. I mean, that is patient intimidation. And especially if that is happening at the rate I fully expect it is, and then also to receive bills that are extraordinarily high, bills that you received before, if you have Medicaid, if you have insurance, that are often sent to you prior to actually even moving through that process, of course you're gonna start having your credit just absolutely decimated. So medical expenses are really, really difficult to deal with in the disability community. And I think we all probably have personal stories like this. And I am really looking forward to these kind of new innovative ways to really manage credit and think about it. And I think we do need to help build trust with the community and say, we are open, we want to welcome you in, we want you to come build wealth with us. And we understand that the way that the medical community treats people with disabilities is not good, and we are open to helping you build wealth to actually manage this and deal with it.
In our last 8 minutes, I have more questions to ask, but I want to make sure that everybody walks away with something actionable, with a deep understanding of the key takeaways you can take back to the financial organizations that you work with. So for the panel, what messages would you like us to walk away with today, and what is the role that you would like financial service providers to really step into? I have a quick story. We've worked with this blind
blind woman, single mom, GED education. About 20 years ago, we helped her get her first job and get off benefits. Shortly after the financial crisis, we helped her track down a bunch of first-time homebuyer programs, which she leveraged and was able to buy a big home, first home. And then a couple of weeks ago, she reached out and said, hey, what do you know about the tax treatment of stock options? Now, that wasn't where you were expecting me to go, right? But what's happened over the last 20 years are things are getting better. The unbanked rate has come down for people with disabilities. Employment is, in fact, up. Good employment is up. So I think my message is the disability community is a market. The disability community is a growing market. And the disability community needs to be considered from a DEI standpoint. Here's the key. Inclusion works, and we're seeing it every day.
Well, you took the words right out of my mouth there. I completely agree. I think I would encourage everyone here to think about how to focus internally and externally on access, equity, and inclusion. If you aren't already thinking across your whole organization on how you can really expand access, expand inclusion efforts, if you have a chief accessibility officer, how are you growing this market? How are you not only employing disabled people, but actually reaching disabled people to work with you and build that trust, build those relationships? This work is not difficult. It is rewarding, and again, it is an untapped market that I think many can really step into.
Yeah, I'll echo the same thing. So people with disabilities, obviously a massive market that's traditionally overlooked and underserved by financial institutions. So there's an opportunity to, you can just start by as simple as making your software more accessible. That's easy cop out, but it's a start, and it'll put you 10 steps ahead of the competition. But there's a lot more that can be done, that needs to be done, of just bringing people with disabilities involving them in decision making, design and things like that to build in a more inclusive financial system.
So our panelists have covered kind of the business side, right? That it's a market, it's a growing market, and as I indicated in my opening remarks, all of us will probably be entering that market at some point in our lives. So very sobering, in my opinion. On the philanthropic side, the corporate philanthropic side, many of your companies do have foundations or have corporate charitable giving opportunities. I would urge you to lean into those as well. If you need business language to put around that, I'd say you are developing new markets. If you're comfortable with just digging into the social good, you're doing the right thing. Some things that you could do, support organizations like the National Disability Institute, the Harkin Institute, organizations like ARC, with their education initiatives, with their advocacy initiatives. And if you'd like to provide support for persons with disabilities who are entrepreneurial, who may have those needs for mobility devices to help them go to work, and to help them to pursue independent lives where they can obtain financial security and health, Principal Foundation funds microgrant programs that, again, are run through organizations like ARC, where persons with disabilities can make a microgrant request to cover just about anything that they might not have the cash on hand for all the reasons we've stated, or it may not be covered by some of the programs that are available to them. We have 3 minutes, so I'm going to do a rapid round. We have this new research, again, that Financial Health Network put out in collaboration with NDI and the Harkin Institute. Panelists, what are the other issues, topics that you'd like to see more research on, or for people to investigate in our last 3 minutes?
Sure. The big one is whenever you're collecting demographic information, make sure you ask questions about disability. There are lots of wonderful data sets out there that do not include disability, and thank you again to Financial Health Network, who's always included disability in all their research.
I think zooming out and saying, you know, all of our systems are connected. And so whether it's building wealth, housing, healthcare, education attainment, employment, all of our systems are interconnected. And so being able to do a big zoom out about how all of these systems work together and how all of this is actually helping us achieve economic security. We need more research there.
An area I'd like to dig into more is the impact of overpayments for recipients of benefits. So overpayments are essentially a request from Social Security to, you know, pay back some amount of the benefits that they've received, you know, could be over a course of years, right? And typically these overpayment letters may be, you know, tens of thousands of dollars that, hey, sorry, we've, you know, overpaid you. We need it back, you know, immediately. And that's, you know, we've already talked about the no wealth to tap. How are they going to cover, you know, Social Security's request for overpayment?
Well, thank you all. I'm so pleased that Financial Health Network was able to put out a report like this. I hope each of you download it, distribute it within your institutions. Thank you, Tom, Kim, and John, for your time today. And I think we've made a record. We're ending on time, for time. Thank you.